This is a Byja Broadcast Enterprise show.
I can't believe it. Again, I met a potential client here at the coffee shop, and they ended up going with someone else. Said they wanted to work with someone who looked more established.
Oh no, that's unfortunate, but honestly, why are you still meeting clients at coffee shops? You should check out J. Kenba Executive Suites.
J. Kenba? Never heard of it.
Really? It's a professional office space right here in Baton Rouge. You can rent an office that's already furnished, plus they include Wi-Fi, secure building access, utilities, on-site parking, and they even handle the regular cleaning. All you have to do is show up and focus on your clients.
Wait, they handle the cleaning too? That sounds way easier than trying to make my home office look professional or hunting for a quiet spot at a coffee shop.
Exactly. And if you don't need a full-time office, they even rent out conference rooms for small meetings and workshops. Perfect for impressing clients without the overhead.
That's exactly what I need. Where do I find out more information?
Just visit jkenba.com and schedule a tour. Trust me, you'll wonder why you didn't do this sooner.
J. Kenba Executive Suites. We provide the professional space. You create the success. Visit jkenba.com today.
Welcome to the Byja Radio Show, recording live with your host, Dr. Byron Jasper, and special production by Becknell Media.
All right, people, we are back for the finale of season 4, and it is episode, funny enough, 44. So it's 444, my friend. And if I say we, that must mean we are in the saddle with the one and only phenom. Again, I use the word very regularly when we bring this brother in because people have stopped me to ask, where is PatientZero? So I'm talking about PatientZero, of course. How you doing today, brother?
Brother, I'm fantastic, brother. How are you?
I'm fine, man. I told you I'm okay being Tito. Just here. I'm here just hold your luggage and hold your golf clubs. That's all.
Man, you can't compare me to Mike, man. You gotta, maybe you might be an Eddie Kendricks to my David Ruffin, but I can't. I'm not the GOAT like Mike, man.
No,
but I'll say this:
I'm Charlie Murphy to your Eddie Murphy. That's what it is. Like I'm here literally as just the person that's going to be supportive and the intellectual enforcer, if you will. But you got all the talent, man. That's all it is.
Well, maybe I'll have a leather outfit like Eddie Murphy and in Raw and Delirious for season 5. Maybe we'll do that.
Would it be red or purple? I obviously know the order, but for you, if you had to choose which one, would you go red or purple?
In honor of the Prince album Purple Rain in the movie, we'll go purple.
The funny thing is, and this I know we're friends, because I was like, if he says red, I'm going to say Michael Jackson. If he says purple, I'm going to say Prince. And the fact that you said Prince before I even said anything, that's pretty funny, because I was like, you have to pick one or the other. It's clearly an homage to those people, right, in my mind.
Absolutely. Because if I wear the red one, I got to wear the red Thriller jacket. And I got to get a wig. And I got to shave my face. And I just got to go full out Mike. With like black loafers, white socks, sparkly glove. Got to do it.
Did he have a sparkly glove in Thriller? I don't think he had a sparkly glove.
No, you know what? He didn't. He brought it out in Billie Jean.
And that's the disrespect to Michael Jackson. The fact that people try to put all of it together, they're putting the Moonwalker glove with the Thriller. That's two different people. That's two different times. You got to get your stuff together if you're going to be a Michael fan, right? You can't just mash them together like that.
Dude, so I'm in a bar last week. I'm hanging out with Frat, just having a couple old fashions, probably an old fashioned too many. And I'm just looking at this gentleman in the club, and he's dressed like Michael Jackson and Beat It. And I'm talking about the Beat It jacket with all the zippers on there. And he's just casually at the bar, chilling with his little Michael Jackson glove and his Beat It jacket on a random Tuesday. And I'm just like,
Something
why?
Right. Something right.
I wanted to take a picture, but I didn't want him to see me taking a picture of him, so I didn't do it.
Good.
But I thought it was pretty funny.
Because it's one or two things that happen in those situations. thing one, the guy is really, really nice. Or thing two, he's also clinically insane. And now he's going to basically follow you home and chop you up into pieces. So, I mean, I think you played it safe, and I'm a fan of that, sir.
Yeah. You know, I can't have I can't have too many crimes committed against me in Houston, man. It's a wild place.
There you go. There you go. Well, again, episode 44, season 4. So
44.
there we go.
Yes. One of my favorite numbers.
I was about to say one of your favorite numbers, I'm sure. What's the 44 reference for this episode, my friend? Since you always have a number reference.
I got a double number reference on this one.
All right, give us the first one.
So my favorite sports team of all time, the New Orleans Saints, won the Super Bowl, and they won Super Bowl 44.
There you go.
Once they won Super Bowl 44, they went to the White House and saw the 44th president and gave him a jersey with number 44 on it. And that's one Barack Hussein Obama. So I'm a fan of the number 44. I like it.
Obviously. I feel like that is I don't know how many people would know that trivia, but of course, diehard Saints fans probably, but I wonder if anyone on the team at the time thought about it like that.
I don't know, man. Maybe. I don't think Breeze was thinking about it. I could see Reggie Bush. Reggie Bush wasn't thinking about it. He was thinking about, Kardashians.
Stop it. I already knew you was going there. Stop it. So before we go off the rails, we are going to dive into this topic today on AI and healthcare, because I already know where you're going. As soon as you said his name, I said, oh my God, do not. So
what would Reggie do, man?
What would Reggie do? Is that the bracelet you go wear
at the White House?
And this is why we can't have nice things, people. So on today's topic of the Byja Radio Show, for people who actually tune in for us on our educational mindset, not just the random pop culture references, we were able to say that we are going to talk about AI in healthcare, which I think is a topic that people are aware of, but not quite as mindful of it being there on a regular basis. And PatientZero, before we hopped on to record, we talked about the topic and just said a lot of people may be aware of AI. A lot of people may be aware of the fact that AI is very prominent in a lot of industries, but don't realize how much it is in healthcare. And we want to not only highlight some of the things that AI is doing in healthcare, but also talk about the places where AI in healthcare can be problematic, so people can start to kind of hopefully formulate their own opinion, but also know that this can be coming to their doorstep, if you will. So we'll start by just talking about basic things of AI in healthcare. So PatientZero, we put together some notes. If you don't mind handling the general description of where the AI in healthcare is or where it may lie, just some basic stuff for people to not, kind of consider where they may see some AI in healthcare, because I really do think people don't realize it's already here, and it's been here maybe for a couple of years. But of course, recently they've heard a wave of things with AI in healthcare, and knowing where it is, I think is going to help to start framing where we're coming from with this.
Sure. So, before we talk about things where AI can go wrong, because I feel like that's the first thing that you think of, right? When you hear things like this, we need to talk about where it already exists, right? So couple of myths. Well, one myth for sure: AI is not robots that's replacing doctors. Let's just start there, right? AI is pattern recognition plus the decision support, right? So it works best with large data sets and repetitive tasks, because a lot of times you got a lot of data. People can analyze the data wrong, or sometimes when you have a lot of data, you might miss some and your output just goes left, right? Well, AI kind of helps sure that up. So some of the things that AI currently does within healthcare is voice dictation and clinical notes, right? Lab systems flagging abnormal trends, imaging assistance such as X-rays, CT scans, automated appointment reminders, which is helpful, and risk scoring for chronic diseases, right? So those things are already in place,
Yeah.
right? But when AI is used correctly, it helps, it helps to build trust,
Yeah.
right? So it reduces administrative burden, it improves efficiency and turnaround times, because we always talked about the doctor burnout, right?
Hmm.
So we talk about how much paperwork you got to do, how much administrative tasks you have to do in the background. AI is going to help with that. It also helps identify problems earlier, and it gives clinicians more times for patients, right? So instead of having to focus on these back office tasks, all these notes, all this charting, get AI to help with that, and then you could provide more care for your patients. So, you know, it's a support for doctors. And last thing, AI is going to support clinical judgment and not replace it.
Yeah.
So it could be used as a resource for doctors as well.
Yeah. So I think you tagged a lot of things that a lot of people may not realize that it's already happening or has been happening for a while. So when we are saying AI, of course, if you're not familiar, we're talking about artificial intelligence, which is
Not Allen
basically
Iverson.
not, well, he could be helping clinical judgment. So don't you slight the answer like that. Clearly the answer. I mean, I just tell you all you should need to know right there when it comes
You know
to,
what? He should have trademarked AI before artificial intelligence came out, because his nickname is the answer. He could have made a lot of money with this. I'm just
yeah.
saying, opportunity miss.
Yeah, agree, 100%. But ultimately, the artificial intelligence that we're talking about is framed in a way where people may start to think about it as new and cutting edge, which is true. There are some that are definitely a lot more new, cutting edge that we've never heard of and never thought of. But a lot of it has been here for a long time. So when it comes to those text message reminders that sometimes come without you even thinking about it for your appointment, that is an AI thing. When it comes to the reminder of getting your appointment scheduled, and hey, you don't have an appointment, but let's go ahead and make sure you schedule because it's been a while, sometimes that can be AI generated. And then the ones that I think a lot of people may be surprised to learn is that a lot of physicians, myself included, can use it to help us with clinical judgment and clinical decision making, because we have to analyze a lot of data and do it quickly. And we're trying not to sit here and waste time having to sift through a lot of paperwork if we can just feed it into the right system, and it helps us get the stuff consistently and concisely formulated in front of us. So that's really helpful, right? It makes it faster, it makes things more efficient. And a lot of times it can also help to make sure things are not missed and mistakes are not made. Now, the newer AI stuff is going to come in where you're going to have people that are going to potentially start using it in a very specific way to try to replace the doctors, but it's not going to always be that way. It's going to be that way where people are saying, hey, I want to use AI as a tool, and this tool is going to make me better. It's going to make me faster. I use the analogy, PatientZero, that we want to use AI like tools in a toolbox. You don't want to just say, hey, I'm going to take the toolbox, set it in front of the actual lumber, and it's going to build me a house. Well, you still got to have the person who knows how to use the tools to make it build what you want it to. But there are going to be people that come in and try to make it the only thing that's used, and it doesn't help them learn stuff in a very efficient way. So now, because their learning is actually starting out with in essence, cheat code, they're going to end up bypassing a lot of the basic foundational learning. And if AI is not there, all of a sudden things are going to go really left, as you already said. It's going to go really badly because, hey, I'm so used to using this tool to help me get to the answer. That tool's not available. The internet's down. The website's down. What do I do? Well, you built it up on thinking that that was going to give you the answer. And now when that's not available, and if you haven't taught yourself how to really use it and learn from it, it's going to actually be problematic. And we don't want that to happen to everybody, but I feel like it's going to happen. Last thing I'll say about it, PatientZero, that I think is helpful is that it does allow people in very unique situations, specifically patients, to benefit that certain things can get caught a lot earlier. You can potentially have diseases, things that are on imaging studies caught earlier because we are using AI to see stuff that otherwise the human eye may miss or may not see. So I bring all that in to say it is very helpful. It's very important. It's something that we are, at least a lot of our colleagues in the DPC space, are using and using regularly. And it makes things a lot faster for us and our patients when we use it, and we use it regularly as well. The downside is what we're going to talk about in the near future is how do you learn and train on it? Who is doing the feeding into AI so people can learn and get smarter off of it and use it in the right way? Those are going to be ethical things that come up, and if we're not using it correctly and ethically teaching the system, then the things that are going to be bad behaviors are going to be taught to this system. This system is just going to repeat it to people who are impressionable and learning, and it's going to teach them bad habits. And we'll give some examples of that as well. But all of that being said, as you summarized all the things AI is doing and can do, and I've kind of talked about, hey, these things are actually here and how they work and how they help us. What are your thoughts, PatientZero, from a patient standpoint when it comes to AI and healthcare? Are you thinking thumbs up, no issues, no concerns? Thumbs down, not a fan of it, wanted to go back to old school medicine, pen and paper, no computers at all, analog type stuff? What were we thinking?
So I'd be a hypocrite if I said anything negative about AI.
Mhm.
I use AI a lot, and I think especially for the administrative tasks and the things in terms of you know checking data and things like appointment reminders, things of that nature. I think AI is very, very good for that. It's gonna cut down back office time, cut down administrative time. So anything to make a process more efficient, I'm all for, and I love technology for that.
Mhm.
Now, you know, I don't have to worry about this because I'm a member of the Byja Clinic, right? But what I wouldn't want to do or wouldn't want is for my diagnosis to be strictly AI from a
Mm.
doctor. And I can see that happening. So AI is just one of those things where if it's used responsibly, it could be something really, really great, really, really powerful. But I wouldn't want somebody to get so lazy to where they start using AI for everything. And then all of a sudden, I'm not really seeing a doctor, I'm seeing AI. And I think that could be problematic. So, but in terms of being a tool and being useful, I fully support artificial intelligence in the medical field and in every other field when it's used properly.
Yeah, I'll jump in and say I'm the same, right? I'm a huge advocate for it. Anyone who listens to us on this platform and then possibly has interacted with us off this platform, we have been advocates for using artificial intelligence and doing it effectively to get a lot of stuff done that otherwise may take us a long time. So we are able to now use this tool to the benefit not only to us but also people around us, and it's been useful for helping people not only from a clinical standpoint, but from an academic standpoint, from a business standpoint, from a financial standpoint, to give people tools that make them better, hopefully financially, mentally, physically, things of that. So I'm a fan of it as well. But I am very skeptical about a lot of the things that are being taught to AI, which then turns around and, in essence, teaches other people based off of what it's being taught.
Facts.
Why? Because, of course, you've probably heard stories or have seen stories of where there are things that AI will say that is just completely unhinged. And it's almost like, who taught it that? How did it learn that? And who made the decision that this was acceptable to feed it into the system? And that's not something that's surprising. So that takes us, I think, into the second part of our first segment, which is basically where are the ethical questions starting or beginning when it comes to AI? What are the problems that arise when AI stops being a support tool and starts becoming more of a gatekeeper, right? Who is the
Hmm.
person that's deciding what data gets used? Who defines the appropriate or necessary types of care? And what incentives shape how AI behaves? All these are questions that we on the clinical side, especially those that think about things being ethical and equitable, we should be questioning, right? We don't want it to just be, hey, AI is great. Everybody loves it. There's no problems with it whatsoever. So let it do what it does. No, we want it to be more, hey, let's be very careful that we're not taking this at face value and it can never be improved or it can't ever be wrong. That's not true. Because how does AI tend to learn, patient zero?
How does it tend to learn?
Yeah.
What it does is it keeps track of data and it constantly reviews data and adjusts itself based on the data results.
Yep. Now
But
you hit.
you're dependent on data that's inputted, right?
Yep.
So you start out with the information that's been inputted, then you analyze that information and the results of whatever you're running, right? But if the data inputted can lead you astray, then AI is gonna be led astray. It's not something that's just gonna say, well, the stuff that was inputted is foolishness. It's not gonna do that. So
Yep.
I just wanted to put that disclaimer out there.
Yeah. So to put it in a different way, and I agree 100% what you're saying, I'll frame it a little differently. AI specifically can have faulty data that comes in or things that have been taught to the system that are not true. But because the person putting it into the artificial intelligence model you're using believes it to be true, it learns that that is fact when it in fact is not true. So that's how historical inequities can cause problems in healthcare. In the idea that someone feeding an artificial intelligence model information about Black people could have more pain tolerance than anybody else, so therefore they don't need pain medication if they break a leg. That's a inequity and a falsehood that now people are trained on, that Black people have a
Correct.
higher pain tolerance. And because of that, now people who come in sickle cell crisis don't get pain medicine. Now, that was already being done prior to artificial intelligence. So if the person training it feeds that same narrative to something they learned that's wrong and has never been corrected,
Correct.
they're feeding the artificial intelligence this narrative. It now starts to teach other people that same logic that's not true. Same thing comes down to financial incentives. If there's an idea that the person feeding the artificial intelligence, the idea that this treatment is the best because they have a financial incentive to give more people that treatment, artificial intelligence starts telling everybody that's the top tier number one gold standard treatment, and that's not true. But the financial incentive was the reason that that model got fed that information, and it doesn't know any better to scrutinize, well, why is this one better than this one? Because the data doesn't really support it. It's because the person feeding it the data is feeding it biased information. And all of that comes back to the main word I just said, bias, right? If there is a bias, whether it's a racial bias, a financial bias, a geographical bias, there's going to consistently be people getting misled and learning bad information and then placing that into the stronghold of, hey, this is what I'm going to prescribe you because this is what AI told me to do. This is what I'm going to teach you because that's what I learned from this system. And no one ever scrutinizes, could this be wrong? Could it be a problem? So patient
That's
zero.
that is perfect. Because I'm so happy you said that, because what happens is a lot of people think that AI is infallible, and it's actually more reliable than human knowledge, when basically it's just a byproduct of human knowledge, because someone had to input all the basics of it, right? Like, so let's compare AI to like a human being, right? Byron, everything that you know and that you learn from somewhere. AI is no different, right? AI is something where everything that was inputted, everything that it has the basis of, came from somewhere, like you said, whether it's a book, or it's a person, something uploaded into the system where, that could have been wrong from the beginning. So I think that was very, very important what you just said. So I just wanted to kind of, piggyback off of that.
Yeah. And I think the other thing, which segment two, we're going to really dig into it, besides the bias, which I think is a glaring problem that a lot of people can easily identify, that, hey, the person teaching this has a bias. It's going to teach the system that bias. The bias then feeds into the system to where that gets repeated and perpetuated over and over and over again. That's something simple. I think the other thing is privacy, right? If you're putting in health information, who owns that information? What can be shared and what cannot? How much information is actually, again, private versus this is something we can now teach other people based on this example? Is it something that people can easily share from person to person because I gave it permission by training you on this system? and the system learned from this person's data. So now the additional data we're feeding it is going to give somebody else an opportunity to learn, but it also can be problematic because where does the line stop where the privacy starts? And that's a huge, huge red flag for a lot of people of what is private and what is not. And I think the very last
Mm,
thing that's important is,
that's
as we
just me
already
too.
talked about, is oversight. And oversight comes down to one specific thing: who, what, when, where makes the final decision on what is valid and what is not. Who, what, when, where makes the determination on when should we now get the human involved, because you've gone as far as we need you to go to get us to a point where it really does need a human touch. So that automation with or without oversight is another issue where artificial intelligence can be an issue overall. It's an issue that, hey, you do have automation, which makes you faster, but if there's no oversight, the algorithm makes the wrong decision. Now this person is now harmed because the decision was made by a computer or a system that does not have the ability to stop itself from making decisions that are going to harm people, because hey, we are just doing what I was taught and I don't see the flaw in my logic, so why would I stop doing anything with that? So I think it actually has a lot of pros, but it's still so early on and there's so many mistakes and problems. There are a lot of cons. So we have to absolutely positively scrutinize everything and not just take it as, again, the gold standard that AI can do stuff. Therefore, it should be able to do it and do it without anybody coming in and trying to basically check the system for flaws and problems and things of that nature.
Yeah.
So, with that, patient zero, I think we've gone a little bit long on segment one, not necessarily the longest we've ever been. I think we've been in segment one all the way up to 40 plus minutes, but we're almost at minute number 30. With us getting close to that, any thoughts on what we have said in terms of problems with AI versus pros of AI that you would say this is the part I think people should know if they've listened thus far?
So I think more for healthcare providers, um, that is not completely infallible is important. You know, because it's not something like, for example, I would, if I were a doctor, which I play one on TV. If I were a doctor, I would almost use AI to like bounce ideas off of. Patient has this, patient has that, blah, 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 right? Let AI come up with something, and it could help maybe spark a thought.
Mm-hmm.
Now you're still responsible for the diagnosis. You still need to do the work,
Mm-hmm.
but just as like a sounding board or just something to kind of like another resource, right?
Mm-hmm.
You can't get so tied up, and this is for anybody. Like you can't get so wrapped up in AI where AI just completely does your work for you.
Mm-hmm.
Like that's not a thing. Now, again, I'm a fan of AI. So there's a lot of pros where it should be integrated in the day to day, especially on the administrative side,
Mm-hmm.
because it's great for those type of things, right? But what you highlighted earlier in terms of the infallacies, the bias, things of that nature, you can get in a lot of trouble with that. So I think you should only use it when it's appropriate. And to me, that's administrative things, back office things, and maybe to spark an idea.
Yeah. I'll say that the thing I want people to take home for the first part of this episode is that the things that are glaringly obvious is just a fraction of where there are problems with this system if it doesn't have a lot of guardrails put in place or people are not ethically sound in its use. One of the things that people don't realize that when you train artificial intelligence, as patient zero said earlier, you're training it on data that is historical. Well, what do you think happens when we're training things on historical data where a lot of Black and brown people are not represented in that data? The studies that happen on certain pharmaceutical drugs, we potentially historically were excluded from those trials. We
Right.
were not allowed to participate in those scientific studies. So the data that's being trained to say that the best treatment for this population is this may be wrong because we never actually were included. So now we have a huge gap, and that gap just widens because now people think that, well, this is the best treatment for everybody, when the treatment is really only good for the people in the study. And who were the people in the study? Well, it wasn't us. So we're just applying a baseline logic that hasn't been vetted and hasn't been proven. And it's just going to continue to grow and grow and grow based off of the original starting point being wrong. So it can be a very helpful tool, but you have to scrutinize how it is used. You have to scrutinize when it is used, and you have to scrutinize who's using it and who has the final say in when the use needs to stop. If we can do that, I think it's going to be helpful and it's going to get better. But in the beginning, if it's just the wild, wild west, if you will, we're going to have a lot of problems. With that, Patient Zero, one of the problems that we're going to talk about in segment 2 has to do with your favorite topic, which you hear me talk about it all the time, but I've heard you say this is the worst thing that you've potentially ever seen in medicine. And it's the words prior authorization, my friend. So just based on that and your reaction, I know you're looking forward to segment 2, but we'll talk about it right after this. Hello there, it's Dr. Jasper from the Byja Radio Show. Are you tired of the broken healthcare system, frustrated by long wait times to see your physician, rush visits, and the sky-high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today. And we're coming back in for the second segment of this 44th episode of Byja Radio Show. And before we get into the topic Patient Zero gets so excited about when he wakes up in the morning, prior authorizations, we're going to do a finale switch up, if you will. Normally, we would probably do this at the end of the episode, but we're going to try to squeeze it in the middle. That way we can get it in early. And if we think of people as we're talking Patient Zero during the rest of the segment, we can obviously come back to it at the end. But we want to basically start by just giving shout outs to people who have listened to Byja Radio for all 4 seasons. And even if you're not for lack of a better term, day one, you're still listening now. We appreciate you, man. I really want to say that because, hey, you could have been anywhere in the world, but you're listening to us. And based on that, I think we just, got to give people some love, Patient Zero. So would you like me to go first, or you feel pretty confident of going ahead? Because I know you got a longer list than, because people come to see you.
I don't think people come to see me. However, there's a name that pops up.
Hold on. Before you go too far, the fact that however didn't have a long pause, the fact that you said it so quickly tells me you know what you're doing, right? Like, this is not a coincidence. You were like, people don't come to see me. However, like, it was just, like, really emphatic how disrespectful that was, brother. I just wanted to say I felt that in my spirit.
Well, I mean, I'm sorry that your spirit was misled in that instance. But if you think about it, it's a medical show. Nobody's listening to the medical show for the dude that's not the doctor. Like, that doesn't make sense.
That's not true. And this is going to be a weird analogy. This is a weird analogy, but I'm going to give this to you. It's almost like Family Matters. The family didn't really matter. It was the next door neighbor. So I'm saying you're giving the Steve Urkel vibes where you didn't took the show over, my friend. That's all I'm saying.
I don't know, bro. I mean, that's a great analogy, but that happened like once in TV history. Like that, you're not Carl and Harriet, right? Because clearly the show was a spinoff from Perfect Strangers. Mm-hmm. Harriet was working with Balky and Larry. So it was a show about Harriet's family. Harriet wasn't that interesting. Yeah, she got replaced later on. You know, Urkel and it look the whole look. It's you know what? I'm gonna get on my soapbox for like 2 minutes. So the show Family Matters to me is the biggest joke in the history of life. Because when I was a kid, I loved Family Matters, but
Okay.
everything about that show was ridiculous. Number one, Judy went upstairs one day and never came back. So how you just have 3 kids and all of a sudden you got 2 and nobody just ever said nothing, right? The show was already about Harriet. It's about Harriet and her husband Carl and the family. And she was so not interesting. They made the show about the next door nerdy neighbor, right? Third thing, Urkel chased Laura for years, and got her at the end of the show. What was ridiculous about that? The whole time, the chick that wanted Urkel was better anyway. Myra looked way better than Laura, and she was way smarter. She was such a better pick. It's not even funny. Like rest in peace, Michelle Williams. She was way more gorgeous than what Laura could ever be. And the fact that Steve ran after Laura and he had that prize at the crib was ridiculous. So, and then the fact that he had to transform into Stefan for Laura to pay him attention. He transformed into Bruce Lee one episode. It's ridiculous, man. I'm sorry, bro, but yeah.
Well, random
But
trivia.
no, but you are not Carl and Harriet of the Byja Radio Show. I just want you to know.
I'm just going to let you know how much that you just proved my point. The fact that your rant had me hysterically laughing that I didn't even want to talk because I didn't want to step on any of the things you were saying because I felt like it was gold. The fact that you actually pointed out not only that Myra was smarter, but Myra also obviously was a better fit. And you started naming all of these episodes. That tells me people aren't coming here for me. They're coming here for that random trivia. I'm telling you that. Now, we couldn't agree to disagree because we got to
We
get back to
disagree.
the segment. But I'm going to ask one piece of trivia to see if you know this because I learned this not too long ago. So there was a robot on the actual Family Matters show. And the robot was, of course, modeled after Steve Urkel. Everybody knows that. The question is, who was the person in the robot? Because, of course, the robot had to move and dance like a robot. So who was the person, potentially, and again, if you don't know their real name, that's okay. Who was the person that was actually doing the robot dancing that was actually basically the robot on Family Matters? I'll give you a hint. He was in a early movie, and again, don't necessarily know the name. He was a dancer that actually did all the robot stuff. So
I was gonna guess Alfonso Ribeiro. That was gonna be my guess. Carlton from Fresh Prince. Because Uncle
No.
Phil pulled up on Family Matters one time.
he did.
Carlton could have pulled up too. I don't know.
So
Yeah, I don't know.
the guy who was actually the person doing the robot was, have you ever seen the movie Breakin'? As in breakdancing? So there was a movie called Breakin' where it's basically people breakdancing, and there was 2 people in Breakin', and the guy who was Turbo, his dance name was called Boogaloo Shrimp. I can't make this up. The guy who literally was in Breakin' 1, Breakin' 2, one of the breakdancing stars, actually played the robot in Family Matters. And most people would
Interesting.
have no idea who he was other than the idea that you've seen him on this other movie. So they basically, he just loved dancing, and apparently they cast him as the robot because the robot always had to do what robotic moves, and breakdancing for the most
Yeah.
part can be very robotic. So
Makes sense.
random trivia. So now you got to watch Breakin', right?
Yep.
So based on
Boogaloo
that, that's a
Shrimp.
good segue to a shout out. So shout out to my brother,
Yeah.
Jarrell, who actually made me watch these movies, Breakin' 1 and Breakin' 2. To this day, funny because I don't think he has rhythm at all. Yes, I said it out loud. But yet he had me watching all these dancing movies, which is funny. So shout
That's
out to
hilarious.
Jarrell. shout out to Jarrell.
And Boogaloo Shrimp sounds like number 58 at King's Walk. That's what it sounds like to me.
With some extra sauce.
Boogaloo Shrimp with rice?
Exactly.
I'd have that.
Exactly.
That sounds tasty.
I'm telling you. So
Yeah.
shout out to Jarrell. who is your shout out? I know you got a
I got
few.
I got to shout out the Silver Fox, man. Our good frat brother Art Dubrell. Art, man, look, Art listens to us in the morning on his walk, and the dude is always giving us like some good feedback, suggested topics, good constructive feedback. So I appreciate Art a lot, man. Shout out to Art.
Yeah, shout out to Art, not only for the feedback, but for the idea that he's actually listening to a health show by doing healthy activity. Like, he's not eating a big bucket of wings, listening to us talk about foolishness. He actually goes and walks, actively pursuing healthy activities while listening to a health-related show.
Yeah.
So obviously Art comes here for me, not you. But everybody
Clearly.
else comes here for you, not me. So Art's on my side. Art's on my side is what I'm
Art's
saying.
definitely on your side because I ate wings before I recorded it. I need to go take a walk too.
And look, you had wings with some boogaloo shrimp.
Oh yeah, man. That's a boogaloo shrimp from Pluckers. Boogaloo and fried rice.
And then get on here and say, your blood pressure high.
Not mine. Mine ain't high at all.
That's funny. Oh, man. All right. So a few more shout outs. I'm going to say real quickly. Shout out to Dr. Chris, a good friend of ours. Dr. Chris also has his own podcast, because it's a radio show, not a podcast, and had me come on for that, but also has been a huge supporter of the Byja Radio Show, not only referencing the show on his show, but also bringing up myself on and things of that. So shout out to Dr. Chris. And,
Dr. Chris might be a PatientZero fan. Dr. Chris might be.
Might be, really.
Yeah. Dr. Chris might be coming for PatientZero.
I got you. Well, I got
best
two
rugby
more.
coach in Baton Rouge, Dr. Chris.
That's right. I don't disagree on that. And yes, we said rugby because we are, we're diverse here at Byja Radio Show. We watch all sports. Okay. I'll also say shout out to Antonio, our other frat brother. He listens pretty regularly. And I'll say that we also have a few people that are, so Trey Club, of course. And we also have a few people that kind of cross different walks for you and for me. So some of our B3 brothers, Fred, Hilton, and I will say Myron, because I'm pretty sure Myron listens as well. So these are some of our B3 brothers that listen. B3 is a whole nother thing. We're not even going to get into that because that's a whole nother topic. But shout out to them for listening and supporting. Anybody else you got, my friend?
Oh, shout out to Fred for smoking all that meat. Fred could barbecue like nobody else, boy. I'm telling you, man. So Fred get 2 shout outs.
That's right.
But also, man, I got to shout out brother Robert Johnson, man, because he listens to the show. He actually was able to get a friend of his in some care by reaching out. So I think he deserves a shout out too, man. Yeah, that's good stuff. So we're making a difference.
Well, shout out to the original GP because he listens as well, and I'm pretty sure he's a PatientZero fan. That's all I'll say.
Yeah. Well, he got to be because I'm his legacy. About to say, if you don't like what's going on, it's his fault.
That'd be so funny if we had call-ins and he was like, you know what, I'm definitely not a fan of PatientZero.
No, I'd be like, joke's on you. You failed. Not me. Nah, but it's all jokes, man. I got the greatest dad in the world, man.
There you go. And I agree that we have a lot of support. So again, we had to get that out the way. There are more people. We always tend to forget to give people shout outs. So we try to do that at least one episode of the season. So this is the shout out episode that can get lengthy, but we're going to keep it moving. So let's talk about the part that we left out on segment 1. So it's AI and where AI can have a big problem. And this is going to possibly surprise some people, but some people who are in healthcare probably are not going to be surprised. So right now there's a pilot program, PatientZero, where Medicare is going to test out artificial intelligence to complete prior authorizations in real life examples, meaning they are going to potentially give people's medical cases over to artificial intelligence to hopefully figure out if a treatment can or cannot be authorized and covered by Medicare. I'm just going to pause because there are way more details, but I want to just get your thoughts because I see your face right now. And I think, again, for anyone who's not watching us, Patient Zero's faces are hilarious because he does not hold back and he has the utmost disgust on his face right now if you can't see it. So, Patient Zero, what are your thoughts on this prior authorization model before we even go into details?
Well, I mean, that's what we need. Just, AI to handle prior authorizations. Like it's bad enough that business people such as myself are like approving or declining medicines that were approved by actual healthcare professionals. Instead of letting the business people do it, we just gonna let the AI robot do it. Yeah, that's that sounds productive. Yeah, this doctor, I don't know, been practicing medicine for about 30 years. He's just trying to keep his patient healthy. But let the business people or you know what, the computer decide if they need this medicine or not, or if we gonna pay for it. Especially somebody who doesn't have the resources, right?
Yeah.
So somebody comes in who's paid their premiums, who's got go to work every day, just trying to get healthy. Doctor says, "Oh, you need this care," and the AI robot is like, "Nope, they got to pay full price."
Yeah.
Even though they got insurance.
Correct.
That seems to me the most counterproductive use of AI that I've ever heard of. So, no, I don't like it, and I think it's stupid.
Yeah, I will give a huge cosign to your statement that it is scary is the word I'm going to use. Of course, I think it's going to be stupid because, of course, how do you train AI to know when to actually have empathy and to take extenuating circumstances into the actual equation to help make a better decision? Because
you can't. It's a machine.
Correct.
It doesn't have feelings.
Correct. And the idea is that if you can't correctly input certain things into the system, it's going to read things as if it's a math equation. It has this word, it has this word, it has this diagnosis, this diagnosis. So therefore, this is the answer. It should be always. It doesn't matter that this person doesn't have a vehicle and can't get to the place you're wanting them to go. You're going to tell them they need to go there because that's what the algorithm says. That's what the equation says. That's what the AI model tells them. It's not about actually looking at people as people. To me, it's looking at people as numbers, and numbers that are often going to be a math equation you're trying to solve. The solve is not always going to be 1 + 1 is 2, but that's what the machine is going to start thinking. If you are a patient who has blood pressure and your blood pressure is now out of control, you need to go with this medicine first. If you do go with that medicine first and it doesn't work, you go with this medicine second. And then if you say it does have a contraindication to the first medicine, it still may point you into a medicine similar to that first medicine because it doesn't know any better. And we can go into more detail about this in a moment, but ultimately it's taking the art out of medicine and putting it into being more of a cookie cutter approach. My student intern who works with us at the clinic every now and again, I talk to her all the time and I say, hey, medicine is an art form because it's not as strategic of if you're going for one direction, you do this and it's always going to be this answer. It could be 7 to 10 different answers depending on a lot of different circumstances. That's the part that makes it artistic because you have to know how to take all of that data, all that information, put it together and paint a perfect picture for that patient. A lot of people don't know how to do that. That's why a lot of people don't practice medicine and they receive care rather than deliver care. But now you're getting a machine or a system that is going to be taught how to do what a human does. And now the machine is going to be supposedly given as much authority as a human without a lot of oversight. And that's going to be problematic in my opinion, because now when you go to appeal the decision, who are you going to appeal to? Because you've now outsourced it to a computer. Are you now going to appeal to a computer? And I will tell you more than likely that's going to be a yes. So a few pieces of data, Patient Zero. So when do you think...
Before you go, I got a question.
Go ahead.
I'm sorry. I got a question. All right. So let's say patient is a diabetic, right? And there's 5 diabetes medicine that could be medicines that's a possibility,
Sure.
right? Let's say, let's say 2 out of the 5 medicines they've already tried didn't work. Maybe another 2 out of the 5 um, doesn't agree with some other medicine that they're currently taking,
Hmm.
which leaves one medicine left as an option. Does the computer take into consideration all that data, or do you, as a doctor, have to go back and try some new medicine that replace the other 2 that it disagrees with? Like at what level, at what point does the input stop?
Yeah.
You see what I'm saying? Like,
Mhm.
I don't understand how a computer can just authorize or disapprove of this medicine just like that.
Yeah. I'll jump in and say your question is valid and it's very, very on point, because I think what it comes down to is the system or the model you're using now goes into you being a data pusher. Okay. You went from becoming a doctor who's practicing medicine, making clinical judgments, prescribing medicine to get a result that hopefully will keep your patient alive and healthier for longer, to now you have to feed data into a system to hopefully convince the system that the data you're feeding it will trigger the result you want. So it's not about the clinical decision making, it's about how do you feed the data into the system. And I think, like you said, if you don't feed it the right way, it's going to automatically deny you. And then now that it's denying you, you have to either go back to try to correct the decision, which is going to take even longer. And then you're going to have to get to a point where you're now having to, at some point, try to get a human on the phone, if you can get a human on the phone. And then if you can get the human on the phone, you got to hope they got sense too. And I'm going to be honest with you, most of the people who work at
That's a
these
long shot.
companies, they don't have sense already. So now you're going to whittle it down to people in a smaller capacity because, hey, we've automated all this. Why do we need 20 people? We only really need 3. So if we need 3 compared to 17 short that we are because we've gotten rid of the other 17, well, how long do you think it's going to take you to get somebody on the phone? It's just going to basically be a revolving door of what they're saying. Now, why am I bringing that up? I'll bring it full circle, PatientZero. The revolving door is that this pilot program is starting in January 2026. This is not going to actually be like 6 months from now. This is going to be literally in about 2 and 3 days from now. So in January of 26, the Medicare pilot program for prior authorizations with artificial intelligence will begin. It's going to affect millions of people who have Medicare. And it's going to basically use AI tools to assist with prior authorization decisions for certain outpatient procedures. So right now it's not medications, but it's procedure based. So whether or not you get a surgery or an injection or some other type of procedure to improve your health is now potentially in the hands of people and or a machine by itself using artificial intelligence. And they framed it in my favorite 3: to reduce waste, to improve efficiency, and to control costs. Now, which of those 3 you think is probably the most important one to them?
To control costs.
Control costs, exactly.
Easily.
That's the idea of why a lot of this is done. If you're cutting people from the equation, you don't have to pay people. They now don't get sick. They don't call out. You don't have to worry about paying benefits to them like Medicare. You now actually save money for one side. The second side is now you're also getting a decision-making tool to potentially now cut down on getting things approved and or getting them to approve things in a very specific way. So if people don't do that, they're going to what? Just not deal with it. If they don't deal with it, you're saving money because people are now not approving, not trying to get things approved. It's no different than a model that we're dealing with now in the nonprofit arm, where there's a bunch of pharmaceutical companies that have come up with a way to now basically become insurance companies. There's a program that we use where when we give prescriptions to the pharmacy, we may qualify those prescriptions to help the underserved. I'm simplifying the program, PatientZero. You're familiar with it. In this program, when we prescribe certain medicines to certain patients, the medicines may help us get in essence, payment that allows us to cover other people's medical care. So with our system, we've used those programs to help get people access to things like financial advisors, nutritionists, chiropractors, mental health professionals. That funding that comes off those prescriptions allows people to get access to care they otherwise may not be able to get access to or couldn't afford. The pharmaceutical company has now stepped in and say, in order for you to get that reimbursement that you normally would get from these prescriptions, you have to give us your data. We have to review your data, and then we have to say if the data is applicable and we agree with it, and then we'll cut you a check for the money that you normally would get based off of your clinical decision making and you trying to help the underserved. Why? Because, we want to cut down on fraud, waste, and abuse because, people are misusing this, yada, yada. It has very little, in my opinion, to do with that. It has more to do with I want to keep money in my pocket. So I'm going to make this as painful as possible for you to get this money because now you have to submit your data to me, the pharmaceutical company. I then get to decide by being judge, jury, and executioner whether or not this is an applicable charge. And then if I decide it's applicable, I now have time to pay you back. What does that sound like to you, PatientZero, where I have to submit something to you? I then have to wait for you to decide if it's an actual thing you agree with. And then once you agree, you then have to tell me within a certain time frame what's going to happen and how much it's going to cost. Does that sound like anything familiar to you that these pharmaceutical companies might be doing?
Sounds like some BS to me.
It sounds like
That's
BS. And it sounds like insurance, right? To me, it's an insurance model that pharmaceutical companies are employing to where they're now telling the doctors, the hospitals, the clinics, and everything in between what is or isn't a suitable claim. It's just the same thing, it's just a different industry. And what are the two big industries in healthcare that do all the lobbying and have all the money? Pharmaceuticals
and
and
insurance.
insurance. So they're just literally taking a page out of the insurance playbook to do that. So in this artificial intelligence model with Medicare, it's just another way to cut costs. And if you're cutting costs by delaying, denying, and getting people to be so frustrated with doing this, they don't even submit the paperwork. You save, you win, patients lose. And now all we're doing is just saying, well, look, we saved a bunch of money on Medicare. So now we can go and do something else with it. But you really aren't, because if you were going to do something else with it, you would have did it already. So we're saving to stop people who've basically paid into this system to get access to care. Now that they've turned potentially 65 or they're disabled, we're now telling these people, you now have to jump through more hoops, but now you get to jump through hoops with an actual machine. So I think it doesn't make any sense on anything that makes sense. And other things that'll drive this point home, the AI that they're more than likely going to use, it has to be trained on data, PatientZero. What kind of data you think they're going to feed it when it comes to prior authorizations? You think it's going to feed it clinical data? It's going to feed it prior authorization data. So what do you think the prior authorization data normally says?
Decline,
deny. We need more information. You need to appeal, blah, 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 blah. So basically you're feeding the system a bad set of precedents and telling it to do it again.
And to be honest, I think a lot of times when they put people through like these appeal processes, they're going to pay it. They just want to discourage people from doing it in hopes that they don't appeal. Like, it's ridiculous.
Mm-hmm.
And like it's very rare you appeal something and it don't get paid for. Like, I'm not saying it never happens, but I'm sure that it happens a whole lot less than you appealing and getting it paid for.
Correct.
You know what I mean? Like, but you know, it's already so frustrating. We've taken a frustrating thing about the industry and just made it more frustrating.
Correct. Made it more complex, more ridiculous, add more third-party people in it, because the big thing about healthcare that we try to do differently in DPC is eliminate all these middle people, middlemen, middle women, whatever you want to call it, in the equation. It's usually PatientZero and Dr. Jasper. And then everybody else is on the outside and we bring them in when necessary. But in regular healthcare, there's the insurance, the pharmacy benefit manager, the prior authorization person, the appeal person, and any and everybody in between that stops him from getting his medicine from the one I prescribe because they want to contain costs. They want to improve efficiency and reduce waste and all these terms they throw out, which mean absolutely nothing. And I bring that up to say the thing that we just talked about, the AI is going to be trained on past approval and denial data. Well, if 80% of stuff is denied on the first pass, and then you appeal and it's approved, well, all it's going to do is tell people we're going to deny and make them go through more trouble to get it approved. So how's that more efficient? It's more efficient to get to a denial. I agree with that. But it's not
But
more efficient
it's
for
more
you as a
efficient to
patient.
them.
Exactly. It's not more
But
efficient to them.
it's not to help the patient. It never was about helping the patient. Because if it was about helping patients, it'd be a non-profit business. But it's about helping the bottom line, so you don't have to pay people to deny. You can just get the machine to do it.
Spoken like a true intellectual right there, my friend, because that's pretty much what I think it comes down to. When we talk about AI and how it's good at doing all this stuff, it's based on the person who's feeding it the information and the system that's feeding it the information being basically good people and good data and good policies being in place. But if you're feeding it corrupt data from a corrupt system from people that have financial incentive to deny care, to delay care, and to stop people from being healthy, what do you think is going to happen when we employ this tool that's been built on a bad foundation? It's just going to crumble. And when it crumbles, people are going to say, well, we didn't understand why. No, you did. You knew exactly what you were doing. But you're going to play innocent because you never want to admit that you are basically a financial person first. And the idea of taking care of family, friends, and anybody else is literally the last thing on your mind because you want to pad your pockets. And I think that's ridiculous. Right. So ultimately, the AI pilot program for prior authorizations, I'm going to be one of the first, if not one of the few, because I don't know how many people are talking about this, that's going to say out loud that this is going to be catastrophic. It's going to be one of the most ridiculous things that we're going to see. And you're going to have a lot of people get hurt by this. And a lot of people leave medicine as a result because we already hate prior authorizations in healthcare. PatientZero, you know this. I've literally been on the phone and you'll come by the office or you'll hear me on the phone talking to a patient when you come and stop by. And I'm talking to the patient about how I just got off the phone doing a prior authorization. I was on the phone for 30 to 45 minutes trying to convince somebody that this person needs medicine that's life-sustaining. And that was talking to a person.
Yep.
Imagine what it's going to be talking to a machine because, hey, it's more efficient. Really? I mean, how? Because right now, the most efficient thing you have me do is send a bunch of paperwork to a random phone number. Somebody magically reviews it. They deny it. They deny it based on this criteria that we got to try 3 medicines before we get to the medicine you want. Then after that happens, we appeal it and we got to go to another set of people. And if the appeal gets denied, my favorite, you have the ability to do a third-party outside review, and that independent review person could appeal it. So now that's 3 things we had to do in order to try to get one medicine approved. And you're going to sit here and tell me that adding another set of people, another set of devices, and another office, and another step is going to make this any faster? I don't see it, PatientZero. I disagree. So as you can hear our discussed in this second segment, it's not because we want to end on a sour note for season 4, but whenever it came up that, hey, look, AI is great. We use it all the time. We're huge advocates, but it's starting to creep into medical care where people who are using it are going to start using it, in my opinion, for bad things rather than for helping people. It's going to be a problem. What they could do, PatientZero, if they wanted to help people, is if they're going to take the prior authorization dollars that they're saving, because, hey, it's more efficient and it's cutting costs, they would take that money and allocate all of the costs they saved and give it to someone to do something good for patients. But you think that if they're saving Medicare dollars, they're going to give that to people, or are they going to reallocate it to a different department or a different branch? And all of a sudden that branch is now going to use it for something that has absolutely nothing to do with healthcare.
Or they'll probably just give it to the CEO.
Well, Medicare is federal, right? So it's not going to be CEO. It's going to be where it goes
Medicare.
back into Medicare.
I was thinking more insurance companies, because they go follow suit.
Of course. Yeah, Medicare leads the charge. But that's why I said, if they show we have saved $100 million in this pilot program, why wouldn't a Blue Cross or a United or somebody follow suit? And then if Blue Cross does it and you're listening to this episode and you have Blue Cross, it's coming to you. Right now, it may not affect you because you don't have Medicare, so it's not a big deal. But if you do have Medicare, this is coming to your doorstep. So when Dr. Jasper writes a prescription or says that you need to potentially see the surgeon and the surgeon recommends that you need surgery, your Medicare now has to go through an authorization from an AI tool. So at that point, you're now at the mercy, use the word lightly, of a machine or a person who's using an algorithm to sift through a bunch of data. And if it's only two people because they cut the department down, you think they're going to sit there and spend a lot of time reading your paperwork, or you think they're going to feed it into that device and get that answer and just keep it pushing?
Yeah, I mean,
So,
they go feed it to the device, because if you, if your department got trimmed down and you got the stack of paperwork in front of your desk, or the stack of emails or whatever, however, digital data, however, you gonna sift through that, or you gonna let the computer do it?
yeah. And at this point, once you're done sifting through it, we use the word sift lightly, your job is to do what? Turn stuff over, because you won't keep your job. You want to keep this
Correct.
Medicare check coming in. You want to keep your benefits. So you're not going to sit there and give pushback on, yeah, look, this isn't really right. It's not helping people. We're hurting. They're going to be like, how many more papers you need me to push through this machine, right? And that's why I said the end result is you, the patient, is getting hurt. Us on the healthcare side, we hate it. We're having that whole moral injury conversation where we hate seeing people get sick and have bad outcomes, but we don't have a choice because no one wants to cover stuff. And when we try to tell people how much stuff costs out of pocket, they're so afraid to pay for stuff because no one ever educated them on when and how to use insurance. They're just basically going to say, I'm just not going to do it. So yeah, you
Right.
save money, but you're also hurting people. And again, the big premise that we always talk about, first, do no harm. So if you don't have in your mind that this is probably a bad idea, I think that that's a problem. And if you don't realize, if you're a legislator or a politician at this point, that prior authorizations are a waste of time, and it's basically red tape to eliminate people from getting stuff that they need, and more often than not, it's more harmful than helpful, then you're part of the problem as well. With that, PatientZero, we will slowly close out because I think we have gone long enough on AI and how it can be problematic, especially in this scenario. Anything you would like to leave the people with about this episode, or about things overall, since we're at the end of another successful season, in my opinion, my friend?
So I think we should do something completely different.
Okay, what you
I
got?
think, since we just went 30 minutes, like 30 minutes being irritated at prior authorizations, we should just say something that makes you happy.
Okay.
So you should, so give me something, Dr. Jasper, anything that just makes you happy.
Oh, that's easy. Being in charge of my own destiny, my friend, and getting to do the direct primary care model has been very, very, very beneficial overall, not only for reclaiming my time, but reclaiming what we call autonomy, where you have the ability to practice medicine the way that you absolutely love to practice medicine. I'm not in a rush. I'm not running from room to room. I'm not having to wonder how many people are going to cancel today. And if they cancel, I feel better because I have more time for myself. That gives me a feeling of, you know what, I got it right. And you know how they'll say, well, money can't buy you everything. And people often think, well, if you work this job and you make way more money, you're going to be happier. That's so false, right? It is so backwards. I realized that I could have made more at the job I was at, but been miserable. So I gladly take less and be able to do stuff like this with you, my friend, and other people who I have the opportunity to just sit down and have a conversation with during the middle of the day and not get overwhelmed, all because of this model and the ability to make my own decisions and do it in the right way. So I'm always happy about that, brother. We've had that talk on plenty of occasions. How about yourself?
That's a beautiful thing, bro. On a less deep, more shallow end,
Is
that
it
I'm feeling
wings?
self-conscious about my answer.
Is it
I was
wings?
going to say, nah, well, wings does make me happy, especially Pluggers wings, because they closed at 2 in Baton Rouge.
Yes,
So
it
now
did.
I'm in Houston, I got Pluggers. But now I was just when you open a box of tennis shoes and you get that first sniff, that first smell of a brand new pair of sneakers, bro, that's like heaven on earth. But I kind of feel a little self-conscious about my answer after your deep and purpose-driven answer.
But this is
So,
why, this is how we're going to settle this, because I feel like this is a great way to close out the episode. Before we come back for season 5, we're going to figure out why people come to the show. Now, it could be simple as saying PatientZero, Dr. Jasper. It could be the combo. It could be the education. It could be whatever you want it to be. But I guarantee the majority of answers are going to be PatientZero. And I'm going to tell you why.
there's no way.
That deep answer I just gave, while it may be warm and fuzzy for a lot of people, ain't nobody going to remember that. I already know that. You know what they're going to remember? That you like wings and sneakers. I guarantee you.
I mean, but dog, your deep answer was so it was so purpose driven and meaningful. Like I almost feel like a shallow individual for liking the smell of new tennis shoes. Like I feel bad now.
Exactly. And that's why I said that would have been a Harriet answer, and you went Steve Urkel, and that's why people always will remember you.
I mean, maybe. I don't know. I disagree. I think if they're listening to the show because they believe in what you're doing, they believe in the Byja blueprint, they've read the book, they've checked out the motto. They don't need me. They don't need to listen to me saying foolishness, man. Like it's just they're here for you, man.
Okay, they don't need to. I agree, but that doesn't stop them from doing. So that should tell you right there all you need to know, my friend. So, but
Maybe.
All right, I agree. So we'll leave it there. Help us make this decision so we can know when we come back into season 5 where it's settled. Now, of course, this can change. It can be very fluid. Like, hey, look, after season 4, PatientZero was the winner. And then I got to come with it in season 5. That could be what it is. But we need to know answers, people. So if you haven't done so yet, like, comment, subscribe, share. We post on social media. You can comment on the clips. We're going to try to make sure we post this clip where we try to decide, why do you listen to Byja Radio? Is it PatientZero? Is it Dr. Jasper? Is it a combo? Is it something else that we're missing? We need to know these answers, people. So that's one thing.
And I'll tell you what, and if the answer is PatientZero, I promise I'll have a soapbox segment every episode where I rant about something that's either really, really great or something that's just pissing me off. One of the two.
I'm with it, brother. And I feel like, again, if the likes and the subscribes and the views go up because of your soapbox, then we figured out the formula that makes us more successful. Because I'm not a hater. I'm going to support it all day because I always start laughing. I always start laughing after your first sentence. So, all right. So with that, we're closing out PatientZero, season 4, episode 44. Any other shout outs you got, my friend?
Nah, man, just shout out to everybody that's listening, everybody that's been here since day one. Shout out to your BNI group who I miss. I love going to visit them. That's always quoting the show when I pull up. So that makes me feel really, really good. So it makes you feel like people are listening, but it also makes you feel like you're helping people because, I feel just by listening, people are taking advantage of the information. They're making decisions to make their lives more healthy and to take care of themselves. And that's a great feeling.
Absolutely. Well, PatientZero took the easy way out. So I've been doing work in my head of going through some names. So I'm going to try to run through a few of them. So you said BNI. So Steve and BNI.
Yep.
Corey, Charles. Those are three people that I know who have listened and commented. And they've literally been like, man, I didn't realize A, B, and C. Or when you said this, I was laughing so hard. So got to shout out the people in BNI. BNI has definitely been great to us as a business. So we are huge fans of those people in BNI. I'll also shout out Kirk. Kirk has definitely been a listener, has been a commenter on the actual social media pages. Shout out to Farah. Farah has been on the social media pages, commenting and listening and doing things of that nature. So definitely got to show love to those folks because they are diehards and they actually listen weekly, right? This is not I caught one episode. I haven't been back in 6 seasons. These are people are like, I heard the last episode. I can't wait till the next one. So that tells us that we're doing something right. I'm sure we're missing tons of people, but definitely want to make sure that we try to tell people, look, we just appreciate everyone because, well, let me go back, PatientZero. I got one more for you. I'm going to say shout out to us, my friend. Shout out to us. You know why? Let me go ahead and get on myself. We were being all nice and polite. Let's go back. Shout out to us because 44 episodes. that's not light work, my friend. Like, I really don't think
Not
people
at all.
realize that is a lot of planning, a lot of sitting down and putting up cameras, microphones, recording, editing, producing, publishing,
Yeah,
posting.
yeah.
Like, that's work. And people think that this is just entertainment. Well, look, we haven't gotten to the point where we got a whole staff yet. So we are not only the entertainment,
I'm about to say, you
we
looking
the
at the
staff.
staff.
We the staff. So shout out to us for 4 seasons,
Facts.
44 episodes, because altogether, I look at some of these other podcasts out here, and unless they've been doing it for a very long time or they have a really big team, we run in circles around a lot of people. Like, some people have literally only put out 6 episodes, and it's been 2 years. And the fact that we're 2 years in and at 44 episodes, I mean, I think we deserve a prize. I mean, I'm just on my, I'm having a moment right now where I realize that we're awesome. Like, I mean, let's just say it out loud, okay? So if you're a listener and you agree with that, again, please share this episode and any other episode that you've learned something about. But that just goes to show that, hey, we're taking it very seriously. We have literally made plans for season 5. We already have other shows coming online that we're already getting ready for under the platform that we're putting together. And we're doing this work. And we're not going anywhere anytime soon. So shout out to us, PatientZero. I mean, mostly you. I'm just here, like I said, carrying bags and making reservations. But, you know, hey, everybody got to
You
play
the
their
brains.
role, is what I'm
You the
saying.
brains behind the operation, man.
Hey, I'm okay with that. I'll take that. So notice that the brains doesn't mean the talent. Do you realize that, right?
Bro, you like Phil Jackson, and I'm over here like BJ Armstrong. I'm just over here chilling, bro.
As long as it wasn't Lamar Odom. As long as it wasn't Lamar Odom.
Oh yeah, no, bro. I'm not. That's the second Kardashian reference in one episode.
I knew you were coming. I knew you were coming with it.
Like, what's happening? Like what's really going on?
Got to bring it full circle.
And since we're talking about like Kardashians and negative things, because of Kardashians, I miss the old Kanye. I think after I get off here, I'm gonna go listen to the College Dropout. I'm just saying.
You have a problem. Because I already know what you're thinking. I'm not going to throw you the alley-oop to actually slam it.
No, I'm not going to say it.
But there's a theme based on all of the people you just said from the male side. I don't know what it might be, but they've all, had stories, is all I'm saying.
Yeah, man. And, I don't have a Ray J story, but, whatever.
On that note, with that, everyone, we're going to close out officially. So, PatientZero, at the end of season 4, episode 44, where can the people find you?
Man, the same place they always can find me, man. At Becknell Media on Instagram. You can find me at George Becknell on LinkedIn. And you can find me at George_Becknell on Twitter, because I'm still calling it Twitter.
Absolutely. And for myself, you can find us from a clinic standpoint at www.byja.org for Byja Clinic. For the nonprofit, you can find the Byja Charitable Alliance at www.byjaca.org. You can find our social media pages at Byja Clinic on Facebook, Instagram, LinkedIn. And you also can, of course, find the Byja Blueprint book on plenty of platforms to learn more about DPC, an introductory guide for direct primary care for patients, for businesses, and for physicians. And more importantly, if you have not done so and you have listened this far, you are a real one, as we always say. But like, subscribe, share, follow, comment, and everything else. We got some big things coming in season 5. We're not going to overshare the hand, but big things are coming, people. And you're a part of it. So let's make sure we do it together. With that, we will close out officially. We appreciate you for giving us 4 great seasons and look forward to seeing you soon.